And so let's proceed to the next speaker. The next speaker will be sharing to us the topic on collaborative health, the case of Maimiat. Am I pronouncing it correctly?
Yeah, it's
Maimiat.
Mimiat. Mimiat.
Maimiat Health. Maimiat offers a free, inclusive app for chronic care available in multiple languages, helping users manage their health proactively. By focusing on habits like diet and symptom tracking, they promote sustainability principles, mindful resource use, collaboration, and respect for internal and external environments. Their Health for Community initiative in collaboration with local partners like pharmacies and NGOs creates a resilient support network that embodies joy and self-empowerment. Ladies and gentlemen, please help me welcome Suraj Kumar Lakmandas, the founder and CEO of Mimiat Health of España.
Hi, everyone. It's a huge pleasure being here. And first of all, a big thank you to all of you. And happy to share what we are doing. And now I will proceed with sharing my screen. 1 second. You should be seeing now. Can you see the screen? Perfect.
Yes.
So, as a founder of Mimiat Health, first of all, I would like to start that this journey starts since I was 18, and since I started with my own chronic condition, and I can for sure say that it affected very strongly to my life. And as it was like a chronic digestive condition, and starting at 18, when you are just starting your career and your educational path, it's something that it mentally affects you a lot, and especially with the continuous flare-ups and such, and it affects your emotional state. You start feel depressed, you start feel not being joyful, and you feel that is there something else that I can do in my life now that I've started this condition? So this is what the inspiration behind Mimiat Health, a venture that I started back in 2023 when I was just 24, and which meant to bring not only technology for people's life, but also making sure that we brought impact to people's lives. So how we could improve it more beyond the technology, how we could bring the community effect, and how we could make sure that people uh, were being supported, because we know that anxiety is such an important part of chronic condition. So we wanted that they felt supported throughout their condition. So I will just give you a preview of what Mimiat Health is, so you understand a bit better. And what we aim via Mimiat Health is to aggregate all patients' data. So we offer an entirely free tool. That's our commitment to society and to chronic patients. And this is something that it was my pledge for other patients, that how they could use a platform in which they could gather all this data and they could share in real time with their healthcare providers. So it's an entirely free tool that it's available already in Europe and in Africa as well, in Kenya specifically. And we offer it entirely for patients, in which they can gather patient-reported data from medical devices, clinical reports, wearables. But of course, as I was saying, that is the technological part that we want, that they can leverage technology to identify flare-ups and to improve their health. But now it's also important that they feel supported since the start of this journey. So of course, we explained that we covered like different conditions such as gastrointestinal, which was my personal experience. So that was the first module that we launched. Then we transitioned to cardiovascular, respiratory, chronic pain, and these are the modules that we are working. So we always explain that we want this connection and bridge to be made so patients can really feel supported and connected, and they can share in real time how they are feeling. And that this data list is leveraged by the healthcare providers to provide them a much more personalized treatments and to avoid potential flare-ups, which have a huge impact on their life. This is a bit also the work that we are trying to do. And our idea is that we want to do SMS integration. So we want to make sure that everyone feels accessible and everyone feels supported in this journey, and offering like a multilingual platform here and making sure that no one is left behind. And that's always our work that we try to do, that everyone does feel supported. And that is the work that we try to do with all our stakeholders, that they see that how we can bring impact to from each and every patient. So there is no any bias. Here it's just a bit on how this works, of course, how patients and providers work, a bit also that we have been receiving institutional backing as well, in which they have supported and acknowledged all the work that we are doing and all the strong social impact that we have towards patient. And much more now coming to the initiative that I have been personally creating since the beginning of 2025, that it's called Impact for Community. And that was meant and then to be created to support patients throughout their chronic condition journey. So the idea was that we could bring different stakeholders who could support patients in their lives in different aspects, but they made sure that they were never felt alone, especially because there are many patients who are still, they don't have their families, or they are far from their families, or they are just suffering in silence. And when we couple that with the fact that they suffer higher anxiety due to their chronic condition, it leads that they are not joyful, they don't feel happy with what they do. It affects their like productivity as well, and much more, they are not happy with themselves, with potentially sometimes even leads to suicide cases as well, as it has been reported by many verified sources too. So that's why we brought all this ecosystem, in which our idea was that different stakeholders could take part of, such as pharmacies, healthcare institutions, independent providers, NGOs, and sports team as well. So we tried to come up with these stakeholders who could actually have a direct impact, a much more focused impact, and which they could feel that they are actually having, and they are being able to help. So how it works is that, for example, with pharmacies, if we focus, they are providing ongoing support right now, and they are giving support via guidance on the medication that patients have to take. Many patients still are not aware for the medicines that they need to take, or they are still not aware what is their chronic condition about. So basically, these pharmacies, they become like a spokesperson. So they are guiding them with tools, resources on how they could navigate. For example, healthcare providers, lead independent providers, or healthcare institutions are using such technology to identify these flare-ups. So overall, they can come to the point of clinical remission. And this helps that they, at the end of the day, it helps them to live better, to live joyfully, and to make sure that they don't feel sad at any point. And much more here, the bigger work that we are doing is with NGOs and foundations, and especially sports teams as well, in which they actually bring them into the spotlight, making sure that they feel supported and raising awareness regarding their condition and making sure that they are not left behind. So coming up with, I selected a couple of case studies which have been the most successful so far since we started this year. And the first case study is with a small club in Barcelona, which is the Club Esportiu Terra Negra, which is a football club, and which is specially dedicated to fostering inclusion for children with disabilities. And these children especially have they are suffering with some chronic conditions as well. And this club specially takes such children, they put them in a team, and they make sure that they feel much more part of a community, but they also get the visibility that they need. And the collaboration that we reached with them is to empower and to give visibility in an international stage, given that Terra Negra is a very local club and it's focused only in a specific Barcelona region. And thanks to our international approach, we wanted to make sure that they get that global visibility, that they can also get funding chances to further expand such initiative across Spain and across Europe as well, and which especially children can enter in a much more in a sport in which they can feel part of something much more big, in which they can feel that they are not alone in this journey. And also this way we could see that their parents were much more involved and they were also feeling much more supported when 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 being with their children in that sense. So for example, now in July or August, we will have a tournament in which again it will be organized by Terra Negra, in which we will be giving support to making sure that they feel that they get that they get the international visibility, but also if we can much more bringing them funding opportunities or also global recognition for their initiatives. And the second case that it has been quite a success and that we are working currently since 2023. It has been with the school, which is ETP Xavier. In this case, it's focused much more to empower the next generation of healthcare providers. there is a tie between Terranera and this school as well, and much more in this support system that we are creating is to empower the next generations of dietitians and nutritionists. In this way, providing them a technology that at the end of the day, it allows them to much more attend patients which are in low income areas. And this way, they also can bring this impact into their scope of work too. And that is why we wanted to work with this school specifically, because they don't have that larger pool of resources to go with bigger partnerships or such, but making sure that they also felt included when digitalizing all their educational system, but also making sure that they felt supported and their students felt supported as well. Much more coming to what patients are saying about this initiative is that at the end of the day, it's impact beyond technology. As I was saying, it's of course much more easy to have a product and launch it for sure. In which at the end of the day, it comes to the point of having a product and making sure that the patients can use it. But we wanted to go a step forward and much more coming from my own experience as well. And this was making sure that no patient feels left behind, and this is something that patients have been appreciated not only for the fact that the technology itself is free, but also for the fact that they have a network of support in which they can rely anytime that they feel anxious, anytime that they feel that they are alone or they don't have anyone to support. So they have these key stakeholders in which they appear as soon as they want. So, and this has been the general feedback, that for example the last one, that it was something that it was coming from a patient who was elderly, and he was saying that of course living with a chronic condition, it was a curse, but thanks to our initiative it was being helpful for him, because at the end of the day he could speak with a network, and he could share how was he feeling and to understand much more how could he improve his lifestyle as well. And at the end of the day, this is an initiative that we have started just this year. We have just very few collaborations, but of course, with our limited pool of resources, we are trying to do our best and making sure that we could bring this impact into more community too. In Asia, specifically in India, given that I'm also an Indian origin citizen, also I've been trying to outreach over there. So of course, we want to bring this emission as soon as in different countries as we can, and making sure that all these patients can feel supported from right away rather than just feeling alone. And if we can save lives through this initiative, that will be our biggest strength to what we are doing. And that was much more from my side. But now I would like to have like an open conversation with all of you, and of course like sharing much more insights and answering all the questions that you might have.
Okay, if you have any question to our speaker. Okay, I would like to start with mine.
Yeah, sure.
Yeah, I really appreciate the way you're doing things in terms of the support system to those who have chronic illnesses and they need some support. And you're
Mhm.
making use of digital technology in
Mhm.
order to provide that a particular support that um, patients or those who because they're, as you said earlier, they only know that they are in trouble. They do not share it to
Mhm.
anyone, but here's the app, and they can openly have sharing on how they feel, how they if in case they need some support. Okay. However, in terms of your partnership with pharmacies, I am very
Mhm.
much interested because sometimes health medical services are actually very much economic in nature, okay? And
Mhm.
so there are areas wherein uh, medical practitioners do not allow patients to be taking medicines without proper prescription. Okay,
Mhm.
and personally, I take it as it's because of course if there are diagnoses, similar diagnosis, and then we could say, okay, you can also take this one similar to what other patient is taking, but medical practitioners do not allow that. And so, when they make use of the app, is it not offending our medical practitioners who really demand a proper prescription from them?
No, at the end of the day, at least the context in Europe and specifically in Spain is that pharmacies are complementing the efforts of healthcare providers. In this case, you have prescribed medicines by the healthcare provider, which is expedited by the pharmacy. But the pharmacy always it's a guiding point. So in fact, literally they put news whenever there is like a medication coming in the TV as an advertisement. At the end of the day, they say, go to your pharmacy and ask to the pharmacist about this medication. So pharmacies, at least in the European context and specifically in the Spanish context, play a big role, given that they are much more a reference point for the patient since years, since decades. So this makes much more a trust relation that they built, and always they seek the first opinion or the second opinion with the pharmacist. In this case, they have their healthcare providers in which they give them support and the required medicines. But there is another like support system which is provided by the pharmacist, and that is a much more close relationship that they have.
Thank you so much. I appreciate that. So, any question to our speaker? Okay, here is a question from Emmanuel. He says, with respect to this digital health technology using mobile, where's
Yeah, yeah. Here I'm reading it. So this is something that we are currently working with, and here we are planning to integrate SMS based tool in which, of course, they can access via SMS. Even now, the aim is that even they don't rely on the app itself, or if they do so, they don't fully depend on having internet network. And this way, at least they can share this data in real time. So at the end of the day, all these variables that they can input are fully standardized, so they can just much more via SMS make sure that they reach them. Of course, we are making sure that this still goes even far beyond. So we making sure that even if it's in worse conditions, so they can still the data is being reached. So we are finding the best way. But after like launching it entirely for free, our next steps was now that we are working with the SMS technology. But after that, we are still seeking other technologies to make it even more inclusive for those regions in which even like SMS technology might not work fully.
Thank you so much. And I'm looking forward for that your initiative to be shared across the globe, and in my case, across Southeast Asia and the Philippines. So is there any other question for our speaker? Okay.